Hi, my name is Paul Cowlins. I'm a naturopathic physician and acupuncturist and former professor of naturopathic medicine in Portland, Oregon. And welcome to my channel. Actually, this is a series on my channel that I wanted to devote to the topic of salutogenic medicine. And I need to explain a bit about what that means. It's not a commonly used term, although in the medical research literature, more and more are talking about this idea of salutogenesis. But salutogenic medicine really, to me, is a summary, sort of a synthesis of a lot of different traditional approaches to medicine. So our current medical model, the so-called biomedical model, is one approach to understanding the human being and health and disease. And then we have all these other so-called alternative or complementary medicines such as naturopathy, classical Chinese medicine, Ayurveda, and so forth. And the question is, how are these just different in terms of the therapies they're using? How are they fundamentally different? I've worked in clinics, so-called integrative clinics, where we have medical doctors and osteopaths, and then there's maybe the naturopath, and then there's some massage therapists and acupuncturists, and we often would come together and talk about patients. And it's very clear that we are all using very different understandings of the human being when we discussed a patient's case. And what years ago that led me to consider is that really what's really key here is understanding what the underlying conceptual models are of the medical system one is using. We often associate medicine, current medicine, biomedicine, with science-based medicine, and we kind of hold that as the gold standard of medicine. And then all the other medicines, these more traditional medicines, are usually measured up to that gold standard. And we use, for example, in biomedicine, the methods of so-called evidence-based medicine, where we conduct clinical trials, we form hypotheses and conduct clinical trials on either medications, pharmaceuticals, or natural supplements, herbs, and things like that. And if these herbs and natural supplements are found to be effective for different conditions, we then bring those into the kind of materia medica and armamentarium of current medical practice. But what I found is that a lot of the natural, so-called traditional and complementary and alternative, or CAM medicines, really differ not just in what therapies they're using, but in the way that how those therapies are used as treatment is different. So basically, when we talk about medicines today, we often use a very specific conceptual model to understand how those medicines work. This model really is based at the level of the cell and even further in the molecular biology of the cell, and then the genetics of the cell. So we can call this the cellular or molecular biological genetic approach. We look at causation at that level. And we have a very specific conception of disease from the biomedical model. That is that the disease is something that we must target. So for example, when we design our therapies, we're targeting specific disease processes, as opposed to more traditional approaches, which I'll explain here shortly, really focused on what are the conditions for health and how do we establish those. And that is what the word salutogenesis refers to, is approaches, conceptual models that really emphasize supporting health rather than emphasizing the focus on treating the mechanisms of disease. So the biomedical model, we can say, is rooted in the cell as the basic unit of life, and it looks at the mechanisms of disease as breakdown in cellular function at some level. And the treatments that we design are usually used to suppress or somehow mitigate those mechanisms of illness. So for example, inflammation. We design medications that are anti-inflammatory at different levels. And as we understand more and more the molecular machinery of the cell, we're able to target those more precisely. Now, natural therapeutics in some cases now are being investigated in that same lens. So we look at natural products, for example, turmeric, curcumin, and so forth, as anti-inflammatory compounds, and we talk about them often in that same way. So that's the pathogenic-cellular model of disease. The other model would be the salutogenic model of disease. And instead of focusing on the cell, we have to look at, the salutogenic approach focuses on the different levels of the human being, the different dimensions of the human being. So human being is, from a more traditional perspective, is much more than just the physical body and the cells. The human being also has life processes, which in traditional thinking were understood as working at a higher order or higher level than physical mineral processes in nature. Now, this has led to a long debate in medicine that I'm hoping to get into a little bit here, the so-called mechanism versus vitalism debate. There's actually some new interesting perspectives on vitalism, which I think a lot of people have not heard of. And so I'd like to maybe bring some of those to the table here. But basically the idea that life processes are working at a higher order, they emerge from the lower level nuts and bolts of the proteins and the enzymes and the genes at the cell level. The life processes emerge from that. And then we have also working with us consciousness processes. So sensation, our inner feelings, desires, instincts, and then higher consciousness or self-awareness processes at work, and then social processes. So there's different, we can say, dimensions of the human being: the physical, the physiologic, the psychologic, the psychosocial dimensions. And they each, in a salutogenic approach, are considered important. Now, the word salutogenesis really comes from the American-Israeli medical sociologist Aaron Antonovsky, who in the late 70s, 1979, I believe, published a book, Health, Stress, and Coping. And in that book, he summarized his then 15 plus years of research in what is it that made people more resilient to illness. And he studied, for example, female Holocaust survivors and found that a significant proportion of them actually, unlike what you might expect, fared very well later in life, better maybe than the average person. So there is some sort of internal resistance factors, as he called them, that or resources that allowed a person to overcome stressors and to live a more robust and resilient life. And so his emphasis was not so much on disease processes and mechanisms of disease, but rather looking at the conditions that make health. And in his case, he focused largely on the psychosocial dimension of things. My interest is really looking at the physiologic dimension of salutogenesis. What is it that maintains our internal environment to be able to better resist outer stressors? This has been given the name of internal terrain historically, and that comes from the French physiologist Claude Bernard in the late 1800s, who postulated this idea of milieu intérieur, or internal terrain. And interestingly, he actually used that term. He borrowed it from another physician, Charles Robin, who used that as a synonym for the old idea of the Hippocratic humors, that there are inner forces that have to be kept in balance, and that once those are balanced, that a person is more resistant to disease and can establish health on the physiologic level. And this led into the idea of homeostasis with Walter Cannon in the early 1900s, and then the idea of homeodynamics, that we don't actually have a static inner environment. In fact, we are always at the edge of equilibrium in an unstable condition. The condition for life is actually to maintain that sort of disequilibrium, and that's actually what creates novelty, but also our ability to adapt to different situations. So that's another big topic I hope to discuss a bit more, this idea of the old Hippocratic humors and what the Greeks called the vis medicatrix naturae, the healing power of nature, which was the forces that maintain those inner humans. Really, we still talk about in medicine in the discussion around homeostasis, homeodynamics. And this is all part of the internal terrain and salutogenesis. So salutogenic terrain approaches really work at establishing the conditions of health in the internal environment, again, versus the pathogenic approach, which focuses on the mechanisms of disease. So the reason I'm starting this channel and this series is that I see a lot in the so-called natural health industry, supplement industry, but also natural health providers, using more and more the pathogenic-cellular model of understanding to understand how natural products work, as opposed to using a salutogenic model, which is where we can say, is the conceptual foundation for a lot of these more traditional medicines. So I think it's very important that we bring these concepts to the surface. You know, a lot of our conceptual models remain unconscious to us. So the conceptual model of modern medicine, again, that we focus on disease, but even things that this idea that, for example, the human being is just a material being, that we have no soul or spirit, that we have no living forces, that we are just matter and chemistry and physics. You know, that is ingrained into modern thinking. We say it's scientific because we can quantify, you know, a chemical reaction and so forth, but it's also an assumption. You know, you can't ultimately say that that's all there is to the human being. That's just an assumption. And we use that assumption that, for example, materialism and physicalism, also the idea of reductionism, that we can reduce ourselves to our smallest pieces and then study those pieces, and then we can build up a picture of the whole. And then mechanism, that the pieces fit together through mechanical ways. So materialism or physicalism, that they're only matter and physical energies like electromagnetism and so forth. And then reductionism and material and mechanism are three fundamental assumptions made in modern medicine or biomedicine that are usually very unconscious to people. They are, interestingly, assumptions that are not scientifically testable through the scientific method, which is where you form a hypothesis and you do experiments to test. It comes before the hypothesis. Like the conceptual models you're using help you form the hypotheses, and that can be very helpful, and it's been extremely useful in modern medicine to give us acute care and trauma care and surgery and all that. But where we've really lost the ball is in chronic disease, and especially things like mental emotional disorders. We're seeing a huge epidemic of this now. We have to wonder, are our approaches based in reductionism, materialism, and mechanism, are those enough? Is the cellular pathogenic model of disease enough to describe and to find solutions for these very complex disorders? And so that's where I think a salutogenic model can come in. I don't want to focus on any specific medicine in particular, for example, Chinese medicine or Ayurveda or ancient Greek medicine, but rather, again, look at all of their commonalities. And that's, again, what I'm lumping together here as a salutogenic model. Now, one additional insight there is that salutogenic, behind our conceptual models, are metaphors. And this comes from, there were two linguist scholars, Lakoff and Johnson, who I believe in the 1980s put out a book called The Metaphors We Live By. And they examine the idea that really when we talk about complex things like life processes or disease or mental emotional states and so forth, our psychology, that we're actually using simpler images from nature, simpler things, and then we abstract those into the more complex areas. So we think in terms of metaphors. And these metaphors guide how we act, how we question things, and so forth. So they give the example, for example, of debate, an argument as war, as a sort of metaphor. So when we debate and we talk about debating someone else, we often talk about fighting them, trying to, outsmart them or outwit them or come up with our own solutions. I won that debate and so on and so forth. So we use these kind of warfare sort of metaphor, and they argue, well, what if you use a metaphor like argument as a dance, where it's really a mutual exchange of ideas. Nobody wins in the end, but rather it's about coming to new understanding through that. That would completely change how you go into an argument in a debate with a person. Well, I would argue the same thing happens in science and medicine, where we have these conceptual metaphors, which again are not necessarily scientifically testable. They're assumptions that we make before we form our hypotheses that we can then test. For example, that the cell is the basic unit of life. A lot of new information that the cell is not the basic unit of life in the human being. The cell, without its environment or extracellular matrix, really can't make decisions on its own. In fact, cells that become individualized are cancer. So we have to look at a broader environmental perspective with the cell. So these different assumptions become cognitive biases that prevent us from seeing and testing different ideas about the human being and about illness processes and what maintains health. So the metaphor of biomedicine and the pathogenic-cellular model is very much based in the metaphor of warfare, just like the idea of the argument and debate there. We often talk about disease as an enemy that has to be fought with our treatments, our more precise and targeted therapies. And we talk about winning, or fighting a cancer, fighting a disease, and maybe they won that disease in a certain way, or they won the battle. This frames how we conceive of illness in general, and it's not something built into nature. It's an assumption we've made. It's a derive again from simpler metaphors, again from warfare, basically, about disease. A salutogenic metaphor would be very different. It would say we're not necessarily interested in fighting the disease, or looking at this as an enemy, but rather cultivating the inner soil. So it's more of a gardening metaphor, like where you prepare the soil with the right nutrients and this different thing. And that leads to better crops and more resilience to insects and fungus and things like that. Or we can say that another metaphor there with salutogenesis would be the metaphor of music, or tuning a musical instrument, that we're tuning the human body to become more resilient to external stressors, whether that be a toxin, a psychological stressor, radiation, whatever it might be, a germ. So this idea of increasing our general resistance resources, and the idea of Aronofsky, I think is really the foundation of that salutogenic perspective. So two different conceptual metaphors, warfare and maybe more one of gardening, or the music metaphor. Very important when you frame questions in medicine along those lines. Then you get very different things that you study and very different answers from what you study. So that's extremely important to think about. And again, I'm trying to bring this awareness out because I think a lot of healthcare providers, but also the public, the media, how we talk about medicine, really these concepts, these metaphors, like for example, the idea of illness is a disease is something we have to fight, the warfare metaphor, is just so ingrained that it's hard for people to see any other possibility. And I want to argue that the salutogenic model actually provides another possibility, and one that is ultimately scientifically testable. We can form hypotheses from a salutogenic angle. For example, looking at the environment, the extracellular matrix of the cell. And if we really back up and say, well, where does the matrix end? It, of course, extends throughout the whole body, but we do have compartmentalized matrices in the organs. So we really have to talk about the organ level of organization, not the cellular level when you look at a salutogenic model. And then look at the forces the informational forces that maintain that internal terrain. And that really comes from the nervous system, including the autonomic nervous system. That's the rest and digest, the parasympathetic, and then the sympathetic fight or flight, and then the enterics. And then each organ has its own nervous system, the heart, for example. And then the endocrine system, hormone system, the major endocrine glands, and then the immune system. So the neuroendocrine immune system with the organs maintain our internal terrain. And that's really where I want to focus the discussion in this series, is looking at what are all those organ systems, what are the nature of the internal organs, how can we support them? So the idea that remedies, maybe, for example, natural products, herbal products, are supporting at the organ level, not necessarily at the cellular level. Now we can reduce it to the cell level if we wanted to, but we have to say that at the organ level, cells work as a whole, as a collective. And there's some interesting evidence showing that, for example, there's this idea of coherence, that cells are all essentially oscillating together in a healthy organ, and all their internal biochemistry is synchronized in the right way. And when that synchronization is disordered, when that rhythm is disturbed, then we start seeing illness. First maybe fatigue, and then maybe some functional complaints from that organ system being weakened, and then maybe full-blown illness where we see biomarkers in your blood change, and then maybe evidence on imaging that the organ is compromised. So this is a very important sort of idea to realize, is that the organs themselves are the organizational level, higher level organization than the cells. And then the neuroendocrine immune system contributes to that. So that's one of the ideas I want to go into. As a kind of a closing or last comment here, I'm going to say that another important topic is the idea of, again, how remedies work. In the pathogenic-cellular model, we think of our current pharmacologic model, which is we take in a substance, we absorb it to a various degree, it gets metabolized, spreads out through the body maybe in different ways, and through the blood, reaches the tissues, and then it works on maybe a cell receptor. So the molecules bind to a receptor, they stimulate it, they maybe inhibit an enzyme or activate an enzyme, something like that. And in the pathogenic cellular model, we're looking at primarily substances that oppose a mechanism. So we can call those the anti-remedies, the anti-inflammatories, anti-hypertensives, and so forth. These are all opposing a disease process. That's pretty much where the majority of our research and funding and ideas and insights in medicine are going right now, is how to develop more and more precise targets for our anti kind of therapies. The founder of homeopathy in the early 1800s, Samuel Hahnemann, called those anti-approaches in a kind of derogatory way. He used the word allopathic to describe it versus his homeopathic system that he was developing. But allopathy or allopathic medicine is now being used as a synonym, or has been used as a synonym for biomedicine, which is based in that pathogenic cellular model way of thinking. Now, salutogenic ways of thinking would work very differently. So salutogenic thinking would say we don't want to give anti-remedies, we want to give pro-remedies, remedies that support an organ system, the liver, the kidney, support its normal processes, increase the coherence of all the cells in that organ so that they now function better, they excrete toxins better, and so forth. And that's where a lot of natural products, especially low-dose natural products, seem to be effective. Now, the research is still emerging in that field. Again, most are not looking at that organ level of understanding. It's harder to measure. But if we look through the literature, there is emerging research that we actually can form hypotheses around that and test it. So salutogenic model would work on more pro kind of remedies, and through the concept of something called hormesis. So the current pharmacologic model says you take in a substance up to a certain limit, it has a therapeutic effect, binding to a receptor and so forth. So the drug is actually doing the action in the body. That's the conventional pharmacologic model. The salutogenic or the salutogenic pharmacologic model I'm proposing here would say that instead, the remedy actually, when it's taken into the body, works as a mild stressor, which then invokes a healing response, which is what supports and strengthens an organ or a gland function or part of the nervous system. And this effect is known as hormesis. And this is now emerging in the pharmacologic literature as a huge phenomena that at very low doses, many of our drugs, but almost all natural products studied now, metals, minerals, even toxic metals and minerals at very small doses, can induce healing effects in the body. So it says that it's not the remedy itself doing the healing, it's the body's response to the remedy that induces a salutogenic healing effect and increases the general resistance of the system. So that is a very different way of thinking about pharmacology, and that's something I want to explore, that hormesis model in more depth, because it really begins to question this idea of supplements, for instance. We talk about supplements in the pathogenic pharmacologic model as saying, for example, they're anti-inflammatory, antioxidant, and so forth. And there's a lot of emerging research showing that actually they are not. The whole antioxidant hypothesis is something I want to look at because it is something that is really seriously being questioned right now, or has been questioned in the last decade based on research and clinical evidence. But basically, we're finding that a lot of these natural products in particular don't really work pharmacologically that well. So we talk about antimicrobial herbs. We have to take a lot of those herbs and the molecules in them into our system to get that antimicrobial effect, and that's usually not practical clinically. But what they do seem to be doing is working hormetically as hormetins, not supplements, but hormetins, to stimulate these healing restorative forces in the organs and in your physiology. So we can make a distinction between supplements and hormetins. Supplements really are still along line that pathogenic cellular model and the current pharmacologic model of thinking, versus hormetins really are more of a salutogenic model of thinking. And that's a totally different approach. And so that would be another important area to explore. And I say that because, again, we're seeing in the natural product industry, in my own field, naturopathy, a lot of use of IV vitamin nutrients in these things. And from one level, it makes sense. You're filling a deficiency, get it into the blood, get it in, bypass the gut barrier so you get it in more effectively. Makes sense from a pathogenic cellular model, deficiency model, which kind of looks at the body as a giant test tube. You got to fill up certain levels of certain amounts. But a salutogenic model would say that actually it's more complicated. A lot of these vitamins are regulated through homeostatic mechanisms based on your hormones, based on your organ function. So just pumping more into the blood won't necessarily solve those problems. And in fact, we have to look at the idea that our natural products are giving more information to the body, not actual substance. Now, certainly in many cases, it's important to target deficiencies and that sort of thing. But it's also important to give information to support salutogenic function. And that is where a lot of our supplements, current supplements, are kind of dumb. They're not able to do that, and IVs included. You know, if you just put more of those supplements in the body, then the question is what do our inner forces do with them? Up to a level, they may utilize them to improve, you know, cell function and so forth. But over a level, they actually accumulate as a burden that we now have to rid, and could actually weaken our salutogenic inner forces, weaken us over time. So that's a very important question: is are we doing harm with some of those therapies? And that's something that is not, I think, being discussed very much, because we think, well, why not give nutrients? It should be a good thing. But again, there's a dose-response relationship here, and the hormesis model suggests that maybe not so good. So that's something that will need to be discussed more as well. All right, so that's a little introduction of what I wanted to cover on this particular series. If you are interested in this series, please feel free to subscribe to my channel. And then if you like this content, feel free to hit the like button, and let me know in your comments what other sort of topics you'd like me to discuss around this idea of salutogenesis and salutogenic medicine. Thank you very much.